Imagine walking into a hospital and trusting your life to someone who's been secretly experimenting on patients for decades. This isn't fiction. This is the terrifying true story of a nurse whose black syringe contained something far more sinister than medicine. Meet Nurse Holloway, a woman who spent 20 years building an impeccable reputation at Metropolitan General Hospital. Colleagues praised her dedication. Patients requested her personally. But behind that caring smile lurked a darkness that would shake the medical community to its core. It started with whispers in the break room. Patients under Holloway's care were experiencing unusual symptoms after routine procedures, mysterious fevers, unexplained complications, recovery times that stretched far beyond normal. But hospitals see complications every day, so these incidents flew under the radar for years. The first red flag came from Dr. Martinez in the emergency department. He noticed a pattern. Patients who'd been treated by Holloway were returning with infections that didn't match their original conditions. When he raised concerns, administrators dismissed them as coincidence. After all, Holloway had never received a single complaint in 2 decades of service. But Dr. Martinez wouldn't let it go. He began documenting every case, building a file that would eventually expose one of the most disturbing medical scandals in recent history. What he discovered was beyond comprehension. Security footage revealed Holloway's secret ritual. Late at night, after her official shift ended, she would return to the supply room with a distinctive black syringe. This wasn't standard hospital equipment. Inside this syringe was a cocktail of unauthorized substances she'd been mixing herself. Experimental compounds that had never been tested for human use. The investigation revealed her twisted logic. Holloway believed she was advancing medical science by conducting unauthorized human trials. She saw patients as test subjects, not human beings deserving care and respect. Her detailed journals contained observations about how different patients responded to her injections, written with the clinical detachment of a researcher rather than the compassion of a healer. The scope of her crimes was staggering. Over 15 years, she had administered these illegal injections to more than 200 patients. Some suffered permanent organ damage. Others experienced psychological trauma that lasted years. 3 patients died from complications directly linked to her experiments. During her trial, Holloway showed no remorse. She maintained that her work would eventually benefit humanity, despite the fact that her methods violated every principle of medical ethics and patient consent. She had betrayed the fundamental trust between healthcare providers and those seeking healing. The hospital faced massive lawsuits and implemented new security protocols. Holloway received a life sentence without possibility of parole, but for the survivors and families affected by her crimes, no amount of justice could undo the damage caused by one person's twisted interpretation of medical progress. This case reminds us that behind every uniform and title is a human being capable of both extraordinary good and unthinkable evil.